Hi, welcome to another edition of Your Health Matters with Dr. Benjamin Bryant, of course, Chief of Staff and General Surgeon for Conneaut Medical Center. Dr. B, I missed you last show.
Well, we missed you too, Pat.
And I enjoy coming on here. I kind of, it gives me something to do in my retirement now. And I told my wife, Michelle, that I really enjoyed coming in here and meeting your guests and listening to all the good things that are happening out there in the health world.
We really do appreciate you coming in.
Well, I enjoy it. I really do. I've been up half the night, I think, waiting to come out here today. So we have a lot of fun here. Got a guest with you today.
Yes, I do. I didn't want to leave right away, though, because I understand that you're not really totally retired.
I might not be after tonight. We'll see what happens.
Okay, well, we'll talk about that on the next.
Okay, great.
Well, we were very, very pleased that Shawn Cooper came out to be with us today and to talk to our community. Shawn handles the nutritional aspect of patient care at UH Geneva, and he's also active here at Conneaut in ways that he will describe. But if you go online or basically if you open any publication, newspaper or magazine, you're going to see the emphasis that's placed on nutrition these days, and as more and more is understood about it and how it relates to being healthy or not being so healthy, and it can have a huge impact on people's quality of life and on their health. And Shawn is an expert in these matters, and he is going to sort of introduce what he does today and talk to us about some of the more important aspects of nutrition and how people can think about that and understand it and implement it in a way that makes sense to them. Right. Would you say that's accurate, Shawn?
Yeah, that's exactly accurate. And thank you for having me on. Thank you for introducing me.
We really appreciate you coming out.
Again, my name is Shawn Cooper. I'm a registered dietitian and the clinical nutrition manager over at Geneva Medical Center. I'm also the developer of the adult outpatient nutrition counseling program in Ashtabula Health Center. And what that means is we have basically set up a program that with a physician referral, our patients can now come sit down for an hour to an hour and 15-minute sessions for outpatient nutrition counseling. So our goal with that is to empower our patients, allow them to take back control in the prevention of diseases and even the management of diseases.
Wow. So they get the chance to really spend some time with you. Mm-hmm. And you give them information and they have a chance to ask questions and so that they understand it, and so they understand how it applies to them. And
right. Yeah, it's a very personal experience. In the past, it's kind of been set up where patients think they're coming to see a dietitian to get some type of cookie cutter program where I'm going to tell them what to eat, how to eat, and kind of this rigid diet plan, which is not at all what we do anymore. We tailor this program to our patients. We meet them where they're at, and we've been having really great success with it so far.
That's great.
Shawn, do you have to be a patient to come to you? If somebody wants to make their life better, can they actually just come and?
No. Well, you need a physician referral, which usually comes from your primary care physicians. Mm-hmm. So, and the primary care physicians have been so great at this point to make sure that our patients are getting this crucial level of care. A lot of what we do works into, preventing hospital readmissions, getting the quality of health care costs down, decreasing length of stay. So this is really a chance for patients to, increase their quality of life.
Well, there's so much of an emphasis on staying healthy these days. I mean, all this, well, we want to, cut down on readmissions, cut down on readmissions. So that means somebody is well enough that they don't have to come to the hospital. Mm-hmm. That's what that means. So, what we're really talking about here is staying healthy. Now, let's say you get and I want to tell the public, it's easy. Your primary care doctor is going to be delighted to send you over to talk. You're not going to meet any resistance there at all. If you tell them that you would like to go and talk to Shawn, they will make the referral. I mean, that's just simply not an issue, not a problem. So let's say that happens, and a person walks in, and they meet you, and what happens?
Okay, so first thing we do, just to take it straight from the top, we obtain your height and your weight, just like many other appointments. And then after that, we sit down face to face, and we just go through sort of everything. The details of your life, your work schedule, your food patterns, your grocery shopping patterns, who lives with you, who may help you be cooking food, and some of the deeper things of why do you eat the way you do. We try to tap into the emotional side of things, and a big technique we use is motivational interviewing, which we sort of guide the patient to coming up with their own solutions and their own interventions. We find that patients generally know the things that they're doing wrong, and you find many more different reasons for why they just haven't started to act on some of those things. So, I kind of help act as the liaison between a patient thinking about something and patient doing it, just getting them over the next hump.
That's very, very important. I mean, that's really where the obstacle.
I'm very interested in this because I'm trying to get myself back into a healthy frame of mind. And could you tell me what you would consider a good breakfast, lunch, and dinner? Do you prescribe by those three dinner or meals?
Yeah, absolutely. Well, that's one of the biggest things that I tend to have to focus with patients on, because given our busy lifestyles and first, second, third job shifts, people's meal patterns have become very irregular. I find that a lot of people don't eat anything during the day, and then eat large meals in the evening, and then snack before they go to bed. A very common pattern, which isn't good in the terms of the things we measure, like body weight, fat storage in the stomach area. That sort of eating pattern can make all that stuff go up. So just normalizing your meal pattern is a huge step in the right direction. So making sure you have a breakfast, a lunch, a dinner, and then a snack whenever you like to snack, if you like to have a snack in the evening or between your breakfast and lunch. But having these established meal times and sticking to them really goes a great deal to regularizing your meal pattern in your day.
Now, once people get this and understand this, they go out, they're motivated, they're okay, I'm going to do this for a while, see how it goes, but I'm really going to do it. So they start to do that. Do they tell you that it gets easier once they make that change? They tell you, okay, it was an effort at first, but now it's natural.
Yep.
Is that what you hear?
Yeah, I encounter that all the time. I have, the feedback I get as well. I have more energy now. I'm even sleeping better. I'm not sleeping as bad as I once was with the tossing and turning. Just all kinds of benefits. And then, you get into the weight loss aspect of it. Now that somebody may be eating meals throughout the day, then they're not eating one large meal during the evening. So through that, they end up consuming less calories, which facilitates their weight loss goals. So then they become even happier and feel more empowered off of that fact. And a lot of times if people can get their meal schedule down, the amount of empowerment it gives them, by the time I see them for their follow-up visit, they already have their goals, their next goals that we're going to set in mind.
Wow. So it really is a question of actually getting started.
Yeah.
Wow. Okay.
Yeah, the hardest part is to just get started, but your first appointment with our dietitians here will be very smooth process that I think you will enjoy.
Now, not just doctors, but certainly us. I mean, we encounter people feeling fatigued all the time. I mean, it's almost universal. I mean, this is something, gosh, I just wish I had more energy. And what we're hearing here is that even something as seemingly unrelated as meal patterns can impact that.
Yep.
And you actually see that.
Yeah.
Why is that? Why do people feel more energetic if they're doing that?
Well, just
You say they're sleeping better. That would have a lot to do with it.
yeah, their sleep. There's without putting a huge amount of food into their bellies right before they go to bed. Some people tend to sleep better. It also comes down to hormonal regulation. Having the same meal, same size meal, roughly the same time every day. Kind of goes a long way to put your body in kind of a homeostatic condition, which is just your general well-being state. Just the
So you're not getting like big swings. Like you go through the day, person goes through the day and they don't eat anything, and then they come home and they have this huge dinner.
Yep.
Okay. So they're going through the day with fairly low blood sugar, and then all of a sudden they get this huge sugar charge. And it's kind of tough for the body to accommodate that, because the body and blood sugar is regulated very, very carefully by the body. There's a very fine balance of hormones there to regulate blood sugar, and boy, it must make it awfully tough for the body to do that if it's trying to deal with the fact that there isn't enough sugar in the blood, and all of a sudden it's overwhelmed.
Yeah, and the amount of rejuvenation somebody can feel just through the simple fact of saying, hey, I can do this, I am doing this, that goes a long way to change a lot of other behaviors and just create a feeling of well-being.
That's terrific. That really is terrific.
Hey, Shawn, now, for instance, what we should prescribe is a good breakfast, an egg, or is that acceptable? Bacon, that sort of thing? You're allowed to have that?
Yeah, I think anything, we hear this kind of back and forth with eggs. I've been getting asked a lot about that. Are eggs the good guy or eggs the bad guy? I would say eggs in moderation are a good guy.
Okay.
You don't have to be worried about that. Just as far as building a breakfast, kind of balancing. Eggs is a great protein source. Throwing in some fruit, maybe some vegetables in your eggs, piece of toast.
Okay.
Not against that at all. I think that's a very well-rounded breakfast.
What about lunch?
Lunch has a lot of different options. I'm a fan of, especially since we're just coming off of winter time, certain kinds of soups, chilies, things like that. Now that the summer is rolling around, we grilled some steaks last night, so I'm bringing some leftover steak for lunch today, and a steak sandwich.
Right.
But just, kind of going at everything with a balance is my motto,
Now, along those lines, some of the things we talk about, that we hear from patients that we encounter, is this what is called Mediterranean diet. Could you talk to us about that a little bit? What is it, and is it a good thing?
Okay. Yeah, so Mediterranean diet is a diet that's been having a lot of good results in the mainstream media. A diet, I think it's about 4 tablespoons of olive oil per day, about 2 servings of fatty fish per week, with your grains and everything. They've seen decreased cardiovascular risk, decreased rates of cardiovascular risk, and some other benefits.
Is it helpful in terms of blood pressure?
Yep, blood pressure. Blood pressure has been another marker that we have seen good things for. And the emphasis on the actual foods is clearly there. I mean, you're talking primarily of a whole food diet, foods that are derived from the earth. And what you get out of that picture is a diet that is low in processed foods.
So low in processed foods.
Yep, and so, whether it be the Mediterranean or any other kind of diet, that's something we all want to shoot for is a diet that is low in processed foods.
That way you don't refine the nutrition right out of it. So-called empty calories and that kind of thing.
Yeah, reading one of my favorite books, the author says, if your great-grandparents wouldn't recognize it as food, then you probably shouldn't eat it.
That's very good. I've never heard that before.
Now, you mentioned steak. And I was going to ask you about that. And I think Doc told me years ago, we've been friends a long time, that you shouldn't eat a lot of steak, but if you want to occasionally have a steak, it should only be the size of about your hand.
Yeah, about the size of a deck of cards, they say.
A deck of cards.
Mhm.
And so you eat steak. And of course, that's, excuse me, a lot of people say you shouldn't eat a lot of beefs, but you probably only eat it occasionally.
Yeah, and I would say, once a week.
That's what we do.
Potentially.
That's what we do too.
So
What about fish and chicken?
fish and chicken we enjoy. Try to get fish, about salmon 2 times a week.
Really?
Yeah, that's one of the, kind of the staples of the Mediterranean diet is getting the salmon, the mackerel, the tuna, the fish that are kind of higher in the good fats.
See, I'm not a fan of salmon.
Salmon?
Yeah.
You got to try the right kind. Some can be fishy, and then others you
Yeah.
can cook up real
Yeah.
good.
Interesting stuff.
Yeah.
Red meat got a really bad rap.
Mhm.
The evidence is conflicting. It increases the risk of cancer. Well, oops, no, it doesn't.
Yeah.
Oh, it increases the risk of heart disease. Well, oops, no, it doesn't. But again, and one of the things we're getting here is this sense of moderation.
Right.
And that really is, I think, critical, isn't it? I mean, if you're having a half a dozen eggs every morning, that might not be super great. But on the other hand, eggs are an excellent source of nutritionally complete protein, okay? And it depends on how you cook them. But in moderation, they're excellent.
Absolutely.
In moderation, red meat is excellent. And so I hope you're getting the sense from Shawn that if you come to see him or his colleagues, it's not a question, well, you can't have that, and you can't have that, and you can't. That's not how it works, right?
No, not at all. Our primary focus is to meet patients where they are. Even if I have a patient that comes in who's drinking 5 cans of soda a day, if they come back to me a month later and said, I'm only drinking 3 cans of soda a day, that to me is a huge success.
Absolutely right. I'm glad to hear you say
Yeah.
that. That's a big deal.
Yeah, that is an absolutely huge success. And, like I said before, by the time the patient's in my office telling me about this, they already have their next intervention or next change in mind. And a lot of times I find it's even more ambitious than the original goal. So really having great progress with that.
Now, if somebody comes in with a specific diagnosis, for example, we've covered diabetes a lot on this show. I am going to have an announcement at the end of the show, Matthew. So if you could, make sure I don't forget that. But if you have a diabetic come in, or if you have somebody who has kidney problems come in, or liver problems come in, can you sort of tailor the dietary recommendations for those conditions?
Yeah, absolutely. Especially, the number one being diabetes. Have seen a lot of diabetics, and their initial consults tend to be a little longer because it is a lot to get through, and they have repeat sessions. But some of the most successful patients that we've had thus far have been the diabetics. So, we try to focus just from the ground up. What is a carbohydrate? What foods have carbohydrates? How can I identify them on the food label? And then, last of all, how do I, kind of prioritize what I should be eating when I should be eating it, and that sort of stuff.
Do you get into things like glycemic index and that kind of stuff with them?
No, I personally don't. I mean, my approach is about as simplistic as it gets.
Excellent.
Which has taken some time for me to develop, but I found that it is working excellent. I've had very good feedback from patients saying, "Oh, the first time I heard this, I thought I had to be a, brain surgeon to understand it." So, and that's our emphasis. We need to make everything relatable and make sure that after an hour the person is leaving much more empowered than when they came in.
So they feel comfortable that they understand it.
Mm-hmm.
All right.
Yeah, and a lot of times I'll let sessions run over until, we'll keep going at it until we have what we need. And then I offer my number and follow up with the patient in a week to see if there are any other questions. Because when they come back in their 4-week time, I want them to be able to see the results.
What about pizza?
Pizza?
Yeah, everybody loves pizza.
Pizza is my favorite food. It's one of my.
Mine too.
It is the number one, in terms of,
Sure.
you go out and buy, it's the number one in the country consistently, smokes all the rest combined.
Exactly.
Americans like pizza.
Mm-hmm.
Right. Yeah, pizza is a great food with a great history, and I've never told anybody to avoid pizza.
Really?
Never.
Okay.
I mean,
Cool.
when we do this process of nutrition counseling, part of it is restoring a person's relationship with food. A lot of times when you're being seen for obesity, your relationship has kind of gotten distorted with your food. So we need to reshape that, because eating is a very enjoyable process for all of us. I mean, it keeps us in touch with our social interactions. It's something we're doing with our families and our closest ones when we're having a good time. And very often, certain foods could have emotional ties. Great grandma's apple pie.
Oh, okay, that's very interesting.
There are emotional ties to certain foods that may not be acknowledged. So, we touch on all kinds of stuff like that during our sessions, and maybe if the eating pattern is unhealthy, we just find a way to tweak it a little bit so it fits within the patient's goals. But no, I don't eliminate foods or anything like that.
And as you're implementing a plan for a patient, it's probably stepwise, I would imagine. I mean, it's not like all or nothing, it's like gradually.
Yeah, absolutely. A lot of times in the sessions, the patients are setting their own goals. And then
If somebody sets a goal that strikes you as maybe extremely aggressive,
Mhm.
you might want to slow it. Do you tell them,
Yeah.
Okay, so because you don't want them to set themselves up to fail.
Right. Yeah, and I explain that to them, and I have some people who say, no, we can do it, but I do offer, my input and say, maybe we could try this, and as for starters, and then next appointment we can get a little more aggressive with it.
So building on the successes.
Mhm.
I see.
Yeah.
Now, during the course of your counseling the patients, do you talk about exercise at all?
Yeah, exercise and obviously physical movement is a huge part of it, and that's another one of those things that intuitively the patient already knows, like, hey, I need to move more. But we'll just come up with some very simple goals. If they're ready for them, we will set some very simple goals related to physical activity. But for those individuals who have maybe just had knee replacements or have broken ankles or can't move that much, I'd like to say to them too that don't wait until you're physically able to move to come see me, because most of the work we do is going to come down to what foods you put in your mouth. So even if you can't get out and do a lot of physical activity or any at all, we can still make a great deal of progress just through nutrition alone.
I've seen some people that to open a bag of potato chips and eat probably almost the whole bag. It's like, and I don't eat potato chips, but how do you get them to get off that kind of lifestyle, or do you?
Yeah. Well, that's a good question. That's one of those maybe behaviors with food that doesn't tend to be so good.
Right.
And my first impression as an intervention goes would just maybe not try to take anything away from them, but let's just try to eat a little bit less when you grab the bag, or maybe instead of grabbing the whole bag and sitting in front of the TV with it, let's just grab a handful, put it in a bowl, and then go watch TV.
Mm-hmm.
Okay, that way you don't have kind of bottomless, endless pit there.
I remember as a kid, that's what my mother did. She only gave you like a few potato chips and a little glass of pop.
Right.
And I'm going to get back to that too. You mentioned soda. Doc once told me, he goes, if you like to drink a can of Coke or Pepsi, enjoy yourself with it. Don't take it away from yourself just because you know it's not good for you.
Right.
But there are a lot of people, as you mentioned earlier, that drink 5, 6, 7, 8 cans a day, and that's can't be good for you.
Right. No. One a day I would never steer anybody away from. If it's something that you really enjoy and it makes you happy, and you enjoy it with a burger or your favorite meal, then by all means. But once it does get into the 5, 6, 7 range, then it becomes hazardous to your health. And a lot of the people that I find that are doing that, they have lost the feeling of I really like this particular food, and have kind of drifted into an area where, yeah, I just did that. Now I feel awful about it, but I'll probably do it again. And that's sort of a snowball with some other, self-esteem problems, and kind of that unnatural relationship with food. So, but some real easy methods we can use to kind of restore that and get that guilt off your shoulders and make you start feeling better.
Excellent.
I think it might be important for everybody to sort of realize, okay, well, I mean, here's this goal, and it's all this changes in behavior patterns and so on, which are, have huge implications for your basic health state, and if you're going to get sick, and if you get sick, how sick, and if you need to have an operation, is it going to affect your ability to recover? All of these things, it's true. But if you're making small incremental changes in the right direction, I mean, you don't have to accomplish the whole thing at once.
No.
You make one change. Say, let's say if you're looking at your situation and you understand, well, I'm going to need to make 10 changes ultimately. Okay, and all you make is one, you've already done yourself a huge favor. Isn't that right?
Yep.
So just shifting a little bit is a big deal. And it's hard for people to understand. It's hard for people to understand that. I just changed this little thing. But if you're at this point and you continue on the way you've been, or if you make that one small change and you get out a year, all that distance, you have made that change. It has that kind of implication. So don't feel like if all you make is one small incremental change, that it's not worth it. It is worth it.
Right.
I'm sure from your experience you would agree that it's worth it.
Oh, absolutely. Even it's a factor over time. Even the smallest change over time grows to be a big change.
And of course, if you make a small change and you succeed at it, makes it easier to do the next one.
Right. Yeah. Once somebody feels empowered, and they, starting is the hardest part. We find with anything, just getting the ball rolling. But once it's rolling, the momentum picks up. I've seen it.
Well, the nutritional component of health is huge, and more is getting revealed about it through research all the time. And these are the sorts of things that people can do. These kind of changes, which I'm getting the impression are not stressful, are not strenuous, are individualized.
Yeah.
Okay, and comfortable. And these kinds of things can have an enormous impact on what's going to happen to you throughout your life.
Right.
If you are able to get your blood pressure down 5 or 10 points, that doesn't sound like a lot, but it's enormous in terms of your heart and the end organs, the kidneys and the eyes and so on. If you can do that, and nutrition has a lot to do with blood pressure, a great deal. If you can get your blood sugar under better control, let's just, without getting real technical about it, but there's things that doctors measure to find out how good your blood glucose control is. And let's say those numbers improve a little bit. Well, I mean, we've talked a lot about diabetes, and we've talked a lot about what sugar does to the arteries and that sort of thing. And if you improve that just a little bit, gosh, I mean, you can save yourself so much grief. So these are things that people can get hold of, take control of, and know that they're really protecting themselves.
Right.
Now you might just think of it also, I mean, sometimes it's hard for people to do these things for themselves, but you would sure want your wife to do it because you don't want your wife to get sick. Or you want your husband to do it because you don't want your husband to get sick. Okay, well, they feel the same about you.
Yep.
They want you to do it so that you don't get sick.
Yeah.
So I guess the point I'm trying to make here is that these are things that people can take in hand. These are things that people can do.
Mm-hmm.
It's not a mystery, and it's not out of your control. It's in your control. And if you have somebody that you're meeting with regularly who will help you monitor it and help you understand how to do it and how to succeed, this is something that you can do. And if it saves you having to go into the hospital, how much is that worth?
Right.
You know what I mean?
Yeah.
So that you get from these segments, you get the impression that doing things that are manageable to make your general state of health better, so that you can keep from getting sick, so that you can keep from having to deal with the sorts of problems that come up when you reach these processes that have gone on long enough that they're really starting to cause diseases now, and not having to deal with that. Oh boy, I mean,
Yeah.
on our end, we see what happens when people get into trouble, and gosh, you just really don't want to get into that kind of trouble.
Right. Yeah. One of the most.
That kind of makes me wonder, how long does a patient have to go to you to get things under control, or is there a timetable, or?
It depends. I've worked with diabetics who, keep diligent track of their regular diabetes
Right.
measurements, and they've seen them go down within 2 weeks.
They've seen their sugar go down within 2 weeks?
Their average
Wow.
sugar, going down within 2 weeks. Or we have another measurement that is typically done at the 3 to 6 month increment called the hemoglobin A1C, and we've already been seeing results go down with that after about a month of care.
Wow.
So it's
That's
fast.
amazing.
Mhm.
It's amazing.
See, and that's the big deal I was talking about. If that A1C goes down, the more it goes down, the more protection you have.
Mhm.
So you, just so the folks out there know, they might not have to go for a whole year for
For nutrition counseling.
yeah, right.
Yeah, we set it up on a kind of as needed basis with the diabetics. I get them in for the first 60 to 75 minute consultation, and then being that it is a more in-depth education, I like to follow up with them in 4 weeks, depending on how that session goes. Maybe we follow up in 4 to 6 weeks, then maybe out to 8 weeks.
Okay.
Okay, so it's not, in my mind, it's if you work at it and reach your goals, it's a level of care that will eventually be stopped when you can do everything on your own and that sort of stuff, or you can stay, as long as you need to till we can get it right.
Excellent.
All right, now let's say, for example, and we had talked about this a little earlier before we started shooting this segment, a patient is in the hospital,
Mm-hmm.
and they are about to be discharged, and as it turns out, this kind of help would be very, very beneficial to them. Is it possible, I'm assuming it's possible for them to get things set up to follow up with you or follow up with one of your colleagues right from the hospital? Is that true? Is that
Right.
possible?
Yep, so I work in the inpatient care as well. I screen for certain patients who would, qualify and be good candidates for these.
Now, you don't do that
interventions.
here. You do that in Geneva.
In Geneva
But
Medical
you have a
Center.
counterpart who does it here.
Yeah, Danielle.
Danielle,
Mhm.
okay.
Yeah.
Okay.
So we identify these patients. We actually get the referral for them, the physician referral, before they leave the facility. The physician referral can be given to the discharge planners, and they will call and actually set up the appointment before the patient has even been discharged from the hospital. So, and the idea behind that is, if we can get to them, say congestive heart failure patient, if we can get with them in the outpatient setting within a week of them being discharged, we can reach them and give them all the tools they need to manage their fluid restriction. and possibly prevent readmission from, becoming fluid overloaded once again. Or
Very
same
important.
thing with a diabetic patient. If we can get with them within a week of them being discharged from the inpatient setting, we can prevent a readmission for DKA or some of the other diabetes affiliated stuff.
So folks, it's important for you to know that ideally, and what we're working towards is that if you're in the hospital, if you have a family member or a friend in the hospital, that the nursing staff is going to talk to you or talk to whoever is in the hospital about the nutritional counseling availability before you leave. But in case they don't bring it up, you can bring it up.
Yeah.
You can talk to the nursing staff and say, I'm aware of this nutritional counseling. I think anything that we can do to help mom feel better and not go back in the hospital. And so could we talk to the doctor about that, or will you talk to her about, or will you make sure that we get that referral?
Mm-hmm.
And that's really all you have to say to the nurses is, will you make sure, please, that we get that referral for nutritional counseling? Then they'll make sure that it happens.
Absolutely. Yeah.
So you can initiate that. You don't have to wait for the doctor to initiate that.
Right. Anything that you think your family member or patient yourself would benefit from nutrition related, all it would take is a question to the nurse, and somebody would be very prompt to meet with you.
Now, do you see people in Ashtabula or just in Geneva?
So I do the Geneva inpatient acute care setting, and then on Tuesdays and Thursdays we are seeing outpatient nutrition consults at the Ashtabula Health Center on Lake Avenue.
Excellent. Okay. So our Conneaut patients could easily get over to AMAC to do that.
Yep, and that was highly factored in. We wanted it to be kind of central for both sites.
Very good.
Mhm.
Very good. Shawn, we really appreciate your coming in today.
Yeah, thank you guys. Really appreciate it.
Yeah. And as time goes by and as these programs develop and get more refined, if we could, we'd like to ask you to come back and kind of give us an update on how things are going and how things are going in our town, and
Absolutely.
and how the Conneaut public is able to make use of this.
Right. Yeah, absolutely.
I would like to. I remembered, Matthew. I would like to again make a little announcement here. UH has a program, an initiative called Health Matters. Pat and I have laughed about how they plagiarized the name of our show. And it's a Health Matters. We talked about this. It's where the public, free of charge, can come into the hospital and sit down with the doctor in an informal setting. It's right here in this room where we're filming, and they're on Wednesdays once a month. This coming May the 11th, there is going to be another in that series. I think it's Dr. Susan Rattay, but I'm not sure. But it's about diabetes. There you will see the phone number on the screen that you can call. Space is limited, but it is free of charge. So if you want to call and pre-register, you'll be able to come in and have a long conversation with the doctor informally and very specific and individualized for you. And the one on May 11th is diabetes.
Very good, Shawn. I really learned a lot today. I don't know if Doc and I have ever had a nutritional person on here. I don't think so.
He's the pioneer.
And it's
Thank
been
you, guys.
very interesting and very helpful. I hope the folks out there learn something from this. And remember, if you have any questions for Dr. Bryant, you can call him at 599-7640, and he'll come on the show and answer your questions for you. So feel free to do that.
Yeah, please feel free to do that. Any questions you might have, and again, Shawn's number, I'm sure, is appearing on the screen, and you can call there, and they will help. They will help make sure that you get in to see him. All right. Well, we really appreciate you being with us today, and we'll see you for the next segment.
Thanks.